Are we good?
Yeah, okay. So
Okay.
I'm going to just introduce you if that's okay.
Yeah,
So
yeah.
my name's Cathy Watson. I'm the founder of Revival Pure Essentials, and I'm a wellness advocate with doTERRA. And today I have Dr. Kawendeep, who's a chiropractor, and she's going to tell us all about how how she uses essential oils in her practice. So go ahead, Kawendeep.
So yeah, thank you, Kathy, for this opportunity to allow me to share my story, my experience with essential oils and my chiropractic practice. So I've been a chiropractor for eight years, and even though my focus is more on women's health and women's pelvic health, even though it's that, but I majority of the people that I see, 80 to 85%, are in chronic pain and in inflammation, have chronic inflammation. And so I find that they need ongoing care, they need maintenance, they need to see me 1 to 2 times a month on a regular basis, because chronic means it's long term. They have it for a while and they need to be on top of it. So I found that when I started to incorporate essential oils, it really help elevated my practice, and also the experience that I've had with by the patient's experience and the patient's outcome with using essential oils. So yeah, I just wanted to share my story, my experiences. Um, can you hear me, Kathy? Okay, good. Uh, yeah, I just wanted to share my story, my experience, and share some patient stories as well, how using these oils really help kind of like take things to the next level for personally for me, and also the clinic as well. So yeah, I was a biochemist before I was a chiropractor, so I tend to geek out a lot when it comes to essential oils. So I'm going to try to keep it simple. And if I do start to do the word vomit, let me know. That
No
happens.
worries.
Yeah, so yeah, I am grateful to have doTERRA, not just personally, but also a part of my practice as well. So that's something I'm very passionate about. So yeah, I'm going to talk, kind of break it down. The topics that I'm going to talk about, the oils that I'm going to talk about, and why I use them. And then hopefully everyone can take something out of this and practice it at home, or share it with their loved ones, the information they'll uh, get from this. So yeah, now chronic pain and inflammation, they tend to both go hand in hand. Like, you tend to have both, and it's hard to tell which came first. It's like the chicken or the egg situation. But I find that, like, you have pain when you're inflamed. Inflammation causes pain, and the other way around, pain causes inflammation. So what I like to do is I like to address them both separately with different set of oils. And what I like to address first is the inflammation when I have a patient come into my practice. So yeah, I deal with the inflammation first, because if I can reduce that inflammation by at least even half of it, I can reduce the pain significantly, and I can actually properly treat that person. So now we have inflammation because, or we have pain because of some sort of disturbance in our muscle, in our joint, in our nerve. However, the added inflammation on top of that pain it intensifies the pain. So what I want to target is the inflammation first. And the first oil that I recommend every person that I see at the clinic is, it's not surprising. A lot of people have heard turmeric essential oil. And this is something, it's the first thing I tell. And if someone says they have inflammation, or I find inflammation, turmeric is the first oil to go for. Now, I've been using turmeric since I was a baby. Because I have an Indian background, um, we practice Ayurvedic principles at home. Um, so Ayurvedic is in traditional Indian medicine. Turmeric is a part of that. And I remember seeing my family, my relatives, my parents, my grandparents always use turmeric, not just for cooking, but for other usages as well. And aches and discomfort, inflammation was one of the usages. Like they would use it if their shoulder was hurting, their knees they had discomfort in their knee. What they would do is they would make a paste out of the turmeric powder, apply it onto that area and wrap it, and that would help reduce that inflammation that they had. So I'm grateful that we have turmeric essential oil. Actually, finding pure turmeric essential oil is very, very difficult on the market. And a lot of people are surprised that doTERRA has a turmeric essential oil. And this is way better than taking the pill or taking the powder internally, because the oil, we all know, anything liquid absorbs readily into our body, especially if we take it under the tongue. So the bioavailability is a lot more with the oil. Like you're absorbing more versus excreting it out. Now I found an interesting research where they showed the pills that they sell in like the drugstores or health food stores, the turmeric pill with curcumin in it, 75% of what you take in actually comes out. You're only absorbing 25%. So I'm kind of grateful that we have doTERRA's turmeric, because you take it under the tongue and you're absorbing most of it. So yeah. Also doTERRA in the US market, they also sell the turmeric dual chamber capsules, which again are a lot more bioavailable to our body than the majority of the capsules or pills that are out there that are derived from turmeric. So yeah, I'm very happy with their oil. I take it every day in my smoothie. And then also if there's a day that I'm having a hard time with my hands because I'm a chiropractor, I take 2 to 3 drops in an empty capsule, and I take the veggie capsule, and I take it internally. Now, in practice, I don't give my patients essential oils internally due to liability reasons. I do recommend them that once they get their oil to take it at home and use it internally, but you can massage this oil. It's perfect to, I like to combine this with copaiba and some coconut oil to really get it deep into our body in like our muscles, our joints, anywhere that we are trying to target. And turmeric really helps soothe out that inflammation and kind of allow the body to rest a bit, because inflammation can be very draining to the body, to the mind. So yeah, turmeric is the go-to. So yeah, that's everyone I see. Pain, inflammation, turmeric. So, and it doesn't taste awful. I find my parents used to take the powder form internally, which again, bioavailability is less than 30%. So you're kind of peeing out a lot of it,
Yeah.
but it tastes awful. It really tastes, it's strong. It's very spicy. So yeah. Another
When doTERRA came out with turmeric,
yes.
we were at conference that year and I was like, yes, because
Yeah.
I have a lot of inflammation too.
Yes. Yeah.
So I put it in my chai tea,
I love it.
and
yeah.
I also take the tablets that doTERRA, the dual capsules that
Yes.
are made with the oil and the I think it's curcumin.
Curcumin, yes.
Yeah, together, which is
Yeah.
supposed to even supersize how that works. So
Exactly.
really
Yes.
yeah.
Yeah.
Sorry, I
Yeah.
was excited about turmeric too.
Yes. And it's very cost effective. Like the oil itself, like you're getting 250 drops. Compared that to the capsules, turmeric capsules or curcumin capsules are quite expensive. If you look at it on the market, like I was at Shoppers one day and I saw $50 for a month's supply. It's kind of ridiculous. So I always stick, this is very cost effective. So yeah, and also inflammation isn't just like muscles, joints. I also offer it to someone who has bloating, because bloating is a form of inflammation. Menstrual cramping is a form of inflammation. So those are other ways, because I deal with pelvic health. Those are also reasons to take turmeric essential oil. So yeah. Yeah, so we'll move on to actually a set of oils. Now, there are 3 set of oils that I also use for inflammation. Now, I change it up. It depends on what's going on with the person. And like before, just a quick review as to how inflammation comes about. So what what happens, it starts off with some sort of stimuli, like a chronic stimulus, irritant. So it could be, so stimulation could be, and stress. Pain is a form of stimulation, like chronic pain for a long period of time. Also, yeah, uh, any sort of stress that is causing the body some sort of disturbance over a long period of time can cause an increase in cortisol level in our body. Our body produces that hormone, and it gets to the point where it gets out of control, and the hormone cortisol reaches actually starts to cause more inflammation in the body. So what I like to do is I like to address those stimuli. So it's like mental stress, emotional stress, physical stress, lack of sleep. Those can all cause an increase in cortisol. So what I like to do is target them so I can not kind of reduce the cortisol level, which can reduce the inflammation. So what I use is balance, serenity, and also adaptive. Those 3 oils. And again, it depends on what I'm going to target for that patient. So balance, I find, is great for mood and like hormones. So trying to regulate that. Serenity for sleep. So a lack of sleep is horrible for inflammation because, again, you heal when you're sleeping. Your body is getting rid of that inflammation when you're sleeping. A lack of sleep is a stressor. It's a horrible stimuli to the body, which increases cortisol. So serenity, even the serenity, the soft gels, those are amazing. And then adaptive for your mental and emotional well-being. So what I like to do is once I figure out, like besides the pain, once I figure out what other factors are contributing to the inflammation, I target that as well. So after my session with a person, I like to pick 1 or 2 of these 3 oils and I massage it either under the bottom of their feet or the front and behind their neck. So I love this area because not only are you absorbing it topically, but you're also getting the aromatic benefits of that oil as well because it's so close to your olfactory nerve, your nose. So yeah, these 3 oils have really helped me in my practice to help my patients out. And I'm not just targeting the injury, the muscle, the tissue. I'm targeting things outside of that, right? So yeah. Now, the point of the essential oils isn't just to mask the inflammation. It is to basically lower it so that the cause of the pain can come out. So I'm going to give you an example. I had a patient recently, and I've seen this patient for a year or 2 years actually, and their pain tolerance is very high. They're very compliant. They're really good. They handle treatment very well and pain very well. But she comes in one day and her entire right side of the body was inflamed to the point where I couldn't even touch her gently. So from the neck to the right side of the arm, all the way to her low back, to her glute. And that was surprising to us. So all that inflammation, I couldn't do anything. I had to send her, because it was a red flag for me. I had to send her to the hospital because I'm thinking infection, tumor, cancer, broken bone. Like I'm panicking because that's not her. I know her body. I've seen her for 2 years. And they did blood work. They did x-rays. Nothing showed up. So they did the ultrasound on the shoulder, and what showed up under all that inflammation was a pinched bursa, something innocent. That was so innocent. Like that's something we can treat within a couple of weeks, but I couldn't do anything because she was so inflamed. So I got her back in, and unfortunately, she had to take some anti-inflammatories temporarily to help her not go insane. But once she did come back, we got her on turmeric, we got her on Serenity because she couldn't sleep at all. And it was able to lower that inflammation down. And then we were able to treat that cause of pain. So yeah, the point of the essential oils is to, for inflammation's sakes, is to help me find the problem, the real problem. Because again, inflammation is masking a lot of stuff in our body. It can mask scary things. So yeah, that's how I love to use oils for inflammation. Now, when it comes to pain, once we get the inflammation down, the essential oils allow me to now target the pain. And that's where I can actually start to do my actual chiropractic stuff, which is like adjustments, soft tissue work, use ultrasound, TENS machine. When someone's inflamed, I can't adjust them. I can't even turn their neck or their back because chiropractic adjustments actually cause a little bit of inflammation, because that inflammation is what's going to help the body to heal. Inflammation is healthy amount of inflammation is required for healing, right? So in terms of when it comes to pain, the oils that I like to use, well, the main ones is this one. I always end my session for pain, deep blue rub. And I find that the deep blue rub is, my patients love this because they can feel that menthol tingling, cooling effect for most of the day. Now, they've tried other things on the market and they say, yeah, it only lasts like 20, 30 minutes. So our deep blue is absolutely amazing, because even me too, the most of the day I rub it on the back of my neck and I can feel it all day, pretty much, the cooling effect. And add 1 or 2 drops of deep blue oil with it, it really intensifies the effect of it, and it lasts much longer. So this is great for pain, like any sort of, it's great for inflammation too, but I find it works great to kind of get the pain down so that we can do what we want to do, like exercise. So we can focus on our exercise, focus on our job, focus on our stretches and yoga. So yeah, I love our deep blue, and patients love it. Like I always run out of samples, those little samples all the time. So yeah, that's one of the things that I use. And I find that the deep blue is great for larger areas. So our back, our neck, our shoulders, our thigh area, the deep blue works really well, the muscles and the joints. When it comes to smaller joints, like our fingers, our our knees and our elbows, I find that wintergreen. I love using the winter, like to me, the scent of wintergreen is a little strong. So I kind of combine it with lemongrass and copaiba, which are both great for pain and muscles. So what I like to do is first I layer coconut oil and then I add copaiba on top, 1 or 2 drops. Like for example, on a knee, I would add 1 or 2 drops of copaiba, and then I would add 1 or 2 drops of lemongrass around the muscles. And then I would add 1 or 2 drops of wintergreen, and I layer it that way for like more so the smaller joints and the fingers. So yeah, that's what I do with when it comes to pain, muscle joint pain. I use combination of those two again, and it's also based on patient's preference, previous experience with the oil. So that's how I kind of guide myself as to what oil to use with the person. And and I also, where, okay, I don't have my peppermint with me, but peppermint is another oil that is amazing for pain. Now, before we start, like before I talk about peppermint, we all know pain is a perception, right? It's how we perceive pain differently. Like my 8 out of 10 might be 2 out of 10 for Cathy, kind of thing, right? So I find that if we can play with that perception, pain is a real thing. It's real. It's there. But if we can play with that perception, we can help reduce the pain. And I find peppermint is great for doing that. So I have another story. I'll quickly share that with you. This is going back years ago. I had a chiropractic session, a course I was attending, And they were talking about how to manipulate your perception of pain, or to do that for a patient. And what they were doing is they were tricking the brain to forget about that pain, or to like using techniques to move your perception of pain away from the body. So what I remember, I woke up with a kink on my left side of the neck, and the instructor was talking, and he noticed that I was like rubbing my left side of my neck, and he had me come up front, and he asked me to turn my head. I couldn't turn my head towards the left side. It was kinked. And he told me to do it on the right. I could do it on the right. And he had me open my mouth, and he had me stick my tongue out. Weird. I thought that was weird. But what he saw was that the right side of my tongue and underneath the tongue was inflamed. It was swollen. And what he did is he grabbed a jar of peppermint ointment. He put on some gloves. He scooped some ointment. It was pure peppermint. That's what he said. It was pure peppermint menthol. And he started to stick his finger under my tongue and started to massage the right side of my mouth. The pain was on the left side. It wasn't aggressive, but it was uncomfortable. And I was teary eyed because it was a little tender, and my mouth is like, the peppermint, the menthol is really overpowering all my senses. And he did that for a good 20 seconds, which felt like forever. And then he had me turn my head, and I could turn my head to the left. He did nothing. He did absolutely nothing, just massaged the inside of my mouth. And basically, what he explained was that he was shifting my perception. He was shifting the pain from my neck, which is a different set of nerve, and by triggering another set of stimulus in my mouth. So these are cranial nerves. These are nerves that come out from our brainstem, which is just underneath our brain. The cranial nerve that goes to our tongue, and the cranial nerve that goes to our neck, that turns our neck. They sit close to each other. So he triggered the nerve to my tongue and my taste, so that the perception was lifted away, the pain perception was lifted away from my neck, and it went and overstimulated my pain, like it was painful in my mouth, but the taste and the cranial nerve for the tongue area that does the movement of the tongue as well. So that was mind blowing. And I think it had to do a bit of the menthol, which was triggering the nervous system, right? So I don't, like I said, I don't give peppermint in people's mouth. Like, I don't offer or like ingest oils in my clinic, but I use that principle, and I rub peppermint in the bottom of the foot of people, for people. And what that does is it shifts the perception. So I did some more research, and what it is that our pain fibers, our nerve fibers, are different from our the temperature fibers, like this nerve fibers that detect temperatures on our skin are different from the pain fibers. So when I rub peppermint on the bottom of the foot, what it does, it activates the the temperature fibers, because it's cool. It's like putting on ice. Like we put on ice when we're inflamed and we're in pain. It's not just lowering the inflammation, it's actually activating our temperature fibers. And peppermint does the same. So the perception changes. Instead of feeling the pain, you're starting to feel the cold sensation in the bottom of your foot. And the temperature of nerve fibers, they work at a higher frequency, so they override the pain signals. Another thing that happened today, just a few minutes ago before our talk, I have a headache today, and I think the temperature, the weather change, and it was all day nagging headache, and I ended up taking a sip of a hot coffee, and my tongue burnt. I burnt my tongue. I forgot about my headache. So it's the same principle. The temperatures, you can manipulate your perception of pain by manipulating other things in your body, like temperature. So peppermint is amazing. You can also take peppermint under your tongue. That will be a lot more effective actually, because your mouth is going to be freezing. I'm very sensitive to taste and scent. So for me, it's very effective. Like I completely forget about my headache, my pain, because peppermint is really powerful for me. Just the menthol itself, it just, yeah, I'm crying after peppermint. So
Really
yeah,
interesting. I've never heard that before.
yeah, that's what they do for concussion patients. So the course that I took, they actually treat concussion patients. So you guys like hockey. So like these big guys were treating Sidney Crosby and his concussion. So they're called the Carrick Institute.
Okay.
And yeah, that's what they do. Or like this lady was in the session too. She couldn't move her shoulder at all. She had partially frozen shoulder. He puts on red glass, like everything she saw was red. And she was like, whoop. I'm like, what? Again, they're manipulating the nerves. So I find essential oils can do that. Not just peppermint, like even the hot oils like cinnamon, clove, the oils that cause that heating sensation too
Yeah.
can work as well. So that's something I really would like to work on and maybe investigate a little bit more, because no one's done that. But yeah, peppermint, that's like the go-to. So yeah, and just to wrap things up, after each session, I tell my patients to go have a Epsom salt bath and put in a couple of drops of copaiba and either frankincense or lavender. And copaiba for the pain and discomfort, but frankincense or lavender, and whatever they pick, is great to calm down the sympathetic nervous system. Again, that is what causes an increase in cortisol, the flight and fight response. So that is my homework, like 2 to 3 times a week to take a 20-minute bath in that. Yeah. And that really helps. So that's basically my protocol. I do also talk about food too with my patients. And so that's where the lifelong vitality comes in, the digestion comes in. And other essential oils like ginger, clove, fennel, which are great to add with your food, and black pepper to add with your food to help fight off inflammation and chronic pain. But yeah, that's all I had to share.
Yeah, thank you so much. I have a couple questions, if that's
Yes.
okay. So I know that you, for at least 7 years before you started using the essential oils, had, I'm sure, a beautiful and successful practice. So
Yes.
what triggered you to make that transition to bring the oils into your practice?
Oh, well, actually, because I've come from an Indian background, we use Ayurvedic Indian traditional medicine at home every day, and essential oils is actually part of it.
Oh, okay.
Essential oil uses Ayurvedic principles, like, hot oils, cold oils, that comes from Indian and Chinese medicine, the
Okay.
yin and yang aspect of it. So I was using essential oils, but not really doTERRA essential oils, but like essential oils or herbs at home. And I wanted to bring that safely into my practice. And doTERRA kind of gave me that comfort, that trust, that I trust doTERRA. I don't really want to bring in a no knockoff brand and use it on patients, because I don't have that trust with them. So yeah, the essential oils allows me to kind of simplify what I do with my patients and really have that connection with them. Yeah, it's so easy to take an oil home. Like, this is the best homework you could give to the patient. Like, people, they don't do their homework. Like,
No.
they don't do their stretches, but they will like diffuse or massage serenity in the bottom of their feet because it takes 2 seconds. So that's part of, like, that's main reason why I kind of transitioned into doing that. And I've had great success. Like, people
Yeah.
love it. No one does it. Like, no, not at least in Hamilton, no chiropractor uses essential oils in their practice.
Wow, that's really,
Yeah.
really interesting. That's great. And with
Yeah.
your background too, you're probably a lot more open to it,
Yeah.
just
Yeah.
because you've been using them all these years and the
Yeah.
herbs and whatever else. That's
Yeah.
really, really neat. So that was kind of leads into my next question, which is perfect. How do your patients feel about this transition? Like, do you find some of them are really into it and some aren't, or do you really feel like once that you use them on them, they're more open, like they're
Yeah,
more open
yeah,
to it?
def yeah, definitely once they well, the first thing is like, "Oh, I didn't know you could massage essential oils. I thought you just diffuse them." That's like
Yeah,
the first thing they say. They're like, "Are you sure this is safe?" I'm like, "Yeah, it's safe." I
yeah,
mean, and then like educate them. But they're most of them, well, I find a lot of people that come to chiropractic come with an open mind,
true.
right?
Yeah,
Yeah. So they are open to it. I've had a few handfuls that have said like uh, they were a little weirded about it.
yeah.
But then what I do start off is with deep blue,
Oh yeah, everyone
which
should be blue.
yeah, and it's doesn't give them a sense of essential oil, but then they're like, "Oh, this is amazing." I'm like, "Yeah, it has essential oils in it,"
Yeah.
and that kind of opens up that conversation with them with oils.
Sure.
Yeah,
And how do you feel like emotionally? Like I know, so when I started using oils, because I have a science background as well, like you,
yeah,
I was really like using it for digestion, you like for physical issues. But
yeah,
then like by chance and kind of by accident, I noticed how much I was actually using for emotional issues as
yeah,
well. And I didn't really know I had emotional issues until I was like, oh, why do I use geranium every single day all of a sudden? And that real pull to what your body needs
yes,
is really interesting. So do you find for you, like, I know you're thinking physical, like inflammation, pain, but do
yeah.
you find you use them for emotional issues as well?
Oh yeah, oh yeah. That's for personally. That's the main reason I use oil.
Yeah,
Is emotional. Uh, something to keep myself because I have little ones at home and
yeah.
just and we actually I'm a family of 8. I have 2 kids, I have my in-laws, we have 2 foster teenagers, and my husband and myself. So it's
Oh,
a
wow.
big family. I
Yeah,
need like this
you need
morning
oil.
I was this morning I know I was going to do a talk. So every couple of hours adaptive all over here just to keep me um at the presence. And frankincense, oh, frankincense, that's my favorite. Like that's an oil that I use all the time. And then yeah, these oils like they don't just treat the physical problems. Like I said, you need to treat the mental emotional side of things as well in order to help with chronic pain and inflammation. Those are huge factors, the mental well-being. Yeah,
For sure. Yeah, yeah. It's great because I have a couple of teenagers, and so I'm diffusing all the time, but what they don't know is I'm diffusing stuff I think that they might need. Like if they're
yes,
like obviously this year's been crazy, and all something in the diffuser that's like maybe very calming or
yeah.
uplifting because they're just like and so I'm a lot of citrus is going in the diffuser.
Yeah,
So I just wish
that's
I had them when mine were little. I think that would
yeah,
be amazing.
yes. I use the baby the kids line. I use that with my kids. I don't diffuse at my clinic unless it's just me here for an hour just on my break because um, we can't like it's a scent free clinic kind of thing
Right.
situation.
Yeah.
Unless I'm seeing someone for an hour because they're doing acupuncture and they're open to it. Because by the time they're done, I find that the aroma kind of fades away
Yeah.
so that the next person doesn't mind at all. But yeah, I do have to be careful in terms of aromatherapy. That's why I use my oils topically mostly
Yeah.
on my
No, I get
patients.
that.
Yeah.
I do that at work as well.
Yeah.
Awesome. Well, thank
Yeah.
you so much.
Yeah. No worries.
I really, really appreciate you being my first guest on my education series.
Hopefully it wasn't a word vomit because
No, it was
you just get
great.
so passionate about something and
I
like
know,
where do
you
you
just
start
can't
and
stop talking.
stop? Yes. One thing I do recommend people to read is the book The Plan.
The
Have you
plan.
heard of it? It's about food and inflammation, and how to find out because the food that's causing you inflammation might not be the same for me. Like I can't eat chickpeas or hummus. No, my face doubles in size, but that might
Okay.
not be the true for someone else. So you know how people say this is inflammatory foods, these are anti-inflammatory. It's not the same. Everybody is different.
Oh,
So the
wow.
plan really kind of helps you guide. And then if you do want to eat a food that is causing you inflammation, like for me, chickpeas or bell peppers, I just use ginger essential oil, black pepper essential oil, clove essential oil that kind of cuts off that inflammation.
That's
So
great.
yeah, yeah,
I saw on your Instagram stories as well that you're taking the Terrazyme as well.
yes,
Yeah,
yes,
we've been doing that for the last month, and I noticed a huge difference with my
yes,
inflammation. So that
yes,
certainly,
and it helps. I actually take it first thing in the morning, empty stomach, and I've been doing this for now 3 months, and I lost 16 pounds.
wow.
Yes, because I found out that I'm lactose intolerant. So is my son. Since I had my second child, I became lactose intolerant,
Okay.
and I'm still having a hard time getting rid of dairy. I'm still having a hard time. So Terrazyme helps, and then I got this recently, the Zengest soft gels.
Oh, okay. I haven't used those. I
They
just take it.
really help.
Yeah.
They really help for bloating, gassy, inflammation, like any sort of digestive problems, which is inflammation.
Yeah.
It really helps.
Yeah.
And I just started using them and I was like, okay, this is my new best friend.
I just take so Teresa, if you got one of the kits, you probably have one called Zengest. I don't know if you're still there.
Yes, I've made a ton of notes,
Yeah.
so I can cross-check what I have here. Just while I'm looking, I did have a question. When you talked earlier about this combination of three, which was balance, serenity,
Yeah.
I didn't catch what the third one was.
Adaptive.
Adapted. Yes, I
Yeah.
do have digesten.
Yep. Yeah.
Is that what you asked me?
Yeah. So that's really, really good for anything digestive issues. So the little soft gels that Kawendeep showed us,
Right.
in there is your Zengest that or Digest Zen. It's the same thing. One's just US and one's Canadian.
Right.
So really, really good for anything digestive.
And they work. They work like within minutes.
Immediately, yeah.
Yeah. And so I'm starting to become, I guess, comfortable with that being dairy free, but once in a while I have dairy in my coffee.
Yeah.
And oh my gosh, it's awful, the feeling. So that really helps.
Really helps. Good.
Yeah. Oh, it works.
That's awesome.
Yeah.
Good. Well, thank you so much. I'm gonna call it a day. I'm gonna stop recording first of all.
Yeah.